My name's Sarah Hayden. I went to the ISU PA program and graduated in 2016.
My name is Laura Pauly. I am a PA and registered dietitian at the Boise VA, and I graduated from ISU in 2010 and started working at the VA in 2015.
I'm Deputy Spencer. I'm a physician assistant. Go by Betty. I have worked at the VA now going on 12 years as of December 4th. And I graduated from Idaho State University in Pocatello in 2004, I think. Yeah, 2004. Oh my gosh.
Hi, my name's Jared House. I'm a physician assistant with primary care. I graduated from Idaho State University in August of 2023.
So my name is Autumn Martin. I am a PA here at the Boise VA. I graduated in 2018 from Idaho State University, and I have been working here for 6 years since.
While I was at ISU, I had one rotation at the Boise VA, and it was for my psychiatry rotation. So I was actually required to go in and see every patient on my own, and then I came out and presented all my patients to the psychiatrist. And I actually did not have that experience in the private sector. Yeah, I definitely felt by the time I was done with my psychiatry rotation, I could go into any room and do my full psychiatric assessment and come out with a plan.
My VA rotation, so I worked with a doctor who allowed me to take control and of my patient care. So I would see the patient, I would do their notation, do their physical exam, and then go present to him and tell him everything that I learned, my plan, assessment, everything. And it just provided a lot of autonomy and let me kind of figure out how I wanted to practice.
Okay. So when I was at ISU, I was chosen for the VA tract, which meant that I had 4 different rotations here. I completed my psych rotation, my surgery rotation, the ER rotation, and the primary care rotation, all within that year. And then I was offered a job after I graduated in 2018. I will definitely say, I did rotations at St. Al's. I did rotations at private hospitals and private practices in the community for my other 4 rotations. And this was the most hands-on, best experience that I had, just because you're able to have a lot of support. It's a teaching hospital, and they really want to prepare you to graduate and come out and know what you're doing. You've seen your own patients, you've treated your own patients, and it's a great experience.
So I had one rotation at the VA. That was my surgery rotation. It was just a great experience overall. Everyone I interacted with was kind, to me, to patients, to each other. I noticed people were definitely practicing evidence-based medicine. People were attending ground rounds. There's a real emphasis on staying up to date, staying educated, and treating each other well. So that was a huge, huge thing I noticed. Not that people weren't doing that at other places, but it seemed to be on another level here at the VA.
When I graduated from PA school, I knew I wanted to work at the VA. There's a lot to it, more than just medicine itself, but I feel like we have a really strong case management team here for our veterans that really helps get the work done and allows me to focus on the medicine. But I think that's one of the biggest challenges with working with the veterans is it's well beyond just medicine at the VA.
Mainly the first reason was because my father and grandfather were veterans. They both went to the VA. They both had great experience. They still do?
I did. I chose to work at the VA as a direct result of my experience on my rotation here. You know, I was just looking for a job where people were treating each other well and had the time to do their work and stay educated. And
They tell you some good stories, or they do make me laugh. Some days they come up with some good ones. Their response to my questions sometimes. Patient, you know, any plans for fun trips or vacations in the near future? He's like, I don't plan anything. I don't even buy green bananas because I don't know if I'm going to be here much longer. So, yeah.
I chose to work at the VA despite having other options at St. Alphonsus and a private hospital in the community, just because, one, I loved the patient population here. To be honest, patients are fantastic. You know, you're working with veterans. I have a family history I have a lot of people in my family that are veterans, so that was a huge draw. You're also working with really sick patients, and so you have a lot of opportunity to, you know, learn and grow and really make a difference in those patients' lives. And there's a lot of socioeconomic kind of things that come into play as well that you don't see as much in the community that made this job a lot more rewarding. The other reasons I really wanted to work at the VA was because, you know, I'd done rotations at St. Alphonsus and other hospitals, and there's a lot of money and push to see more patients and have less time with patients and not be able to actually get to know the patients and develop that relationship. Whereas at the VA, I still feel like they really value having that provider and patient relationship. You get time with the patients. We have support systems in place for patients who don't have the funds to get care. We have transportation in place for patients who can't get in. And we're flexible. So, you know, I feel like the VA really wants to work with the patients to get them feeling better, and it's not about the money. Where when I worked at other hospitals, you could definitely tell it was get them in, get them out. We're just trying to, you know, they're numbers, they're not people. So I really, really wanted to work here when I graduated.